Bismillahirrahmanirrahim. Welcome to my PEP lecture regarding the nursing care about diabetes mellitus. तो स्पेशली ये हमारा जो है पेप लेक्चर है वो असल में नर्सिंग केयर के हवाले से है कि एक नर्स जो है वो फॉर एग्जांपल डायबिटीज़ मेलाइटस में वो क्या किरदार अदा कर सकता है. तो स्पेशली दिस लेक्चर इज़ रिलेटेड टू द नर्सिंग केयर रिगार्डिंग द डायबिटीज़ मेलाइटस. So first of all, you will have to improve the nutrition level, the basic nutrition. So the first one is to assess the current timing and content of the meals. So it is very important. You will have to focus the current timing and content of the meal, as we know that we are continuously using different type of diet. It may be in the form of proteins, carbohydrate, vitamins, macronutrients and micronutrients. So depend upon that. So first of all, you will have to assess the current timing and content of the meals. Second, हमारे पास आता है जो advise patient on the importance of individualized meal plan in meeting weight loss goals. Weight loss goal, it is very important that we should do properly. अगर हम continuously exercise कर ले, weight को हम loss कर ले, तो specially diabetes के जो chances होंगे वो कम हो सकते हैं. इसके अलावा थर्ड पॉइंट जो है रिड्यूसिंग द इनटेक ऑफ कार्बोहाइड्रेट. सो यू विल हैव टू टेक लेस क्वांटिटी ऑफ कार्बोहाइड्रेट इनटेक को हमने कम करना है. इट में बेनिफिट सम पेशेंट्स, हाउ एवर फैट डाइट्स आर डाइट प्लान्स दैट स्ट्रेस वन food group and eliminate other are generally not recommended. So it depends upon you. You will have to reduce, you will have to maintain the concentration of all these nutrients. It may be in the form of carbohydrate, it may be in the form of vitamin, it may be in the form of fats. So it must be taken in a very small amount. Discuss the goals of dietary therapy for the patient. So this is the fourth point. Setting a goal of 10% of the patient actual weight loss over the several months, and usually achievable and effective in reducing the blood sugar and other metabolic parameters. So as well as the nurse is responsible to assess the patient to identify the problem that may have an effect on the dietary adherence and possible solution to these problems. And it is also very important to emphasize the lifestyle changes should be maintainable for life. So lifestyle changes, it is also one of the important parameters. Explain the importance of the exercise in maintaining reducing the body weight. ठीक है, नर्स को ये भी करना चाहिए कि फॉर एग्जांपल जो डायबिटीज़ के जो पेशेंट होते हैं उसको प्रॉपरली एक्सरसाइज पे मतलब फोकस करना चाहिए और बॉडी वेट को रिड्यूस करना चाहिए, कम होना चाहिए. स्पेशली कैलोरिक एक्सपेंडिचर फॉर एनर्जी एंड एक्सरसाइज. यू विल हैव टू लूज मोर एंड मोर एनर्जी, सो इट मीन योर बॉडी वेट विल बी लॉस्ट. Carry over of enhance the metabolic rate and efficient food utilizations. Assist patient to establish goals for weekly weight loss and incentives to assist in achieving them. Strategize with the patient to address the potential social pitfall of the weight reduction. So it is very important, as we know that whenever the concentration of glucose, whenever the amount or the content, the glucose content, they become elevated and inside your body, so you will have to overcome on them. So for that thing you will have to do a proper exercise and you can change your lifestyle. अच्छा, पॉइंट नंबर बी में है टीचिंग अबाउट इंसुलिन. सो इंशाल्लाह माय 6th लेक्चर विल बी इंशाल्लाह अबाउट इंसुलिन के हवाले से इंशाल्लाह मैं फिर आपके साथ जो है वो पॉइंट्स में शेयर करूँगा. ठीक है. Teaching about insulin. So teaching about insulin means assist patient to reduce fear of injections by encouraging verbalization of fears regarding insulin injection, conveying a sense of empathy and identifying supportive coping technique. ठीक है. तो स्पेशली नर्स का एक रोल ये भी है कि उसने पेशेंट को जो है उसको encourage करना है, ठीक है, मोटिवेट करना है, स्पेशली थ्रू वर्बलाइजेशंस. वर्बली आपने ये कहना है कि आपने जो है अगर लेट्स अगर कोई फॉर एग्जांपल अगर कोई आपके साथ नहीं है तो किस तरह आपने ये इंसुलिन इंजेक्शन जो है उसको आपने लगाना है। तो स्पेशली उसको आप जो है ट्रीटमेंट प्रोटोकॉल के हवाले टू आइडेंटिफाई दिस सपोर्टिव कोपिंग टेक्निक कि किस तरह आपने उसको एडमिनिस्टर करना है। सो इट मीन दैट this is another responsibility of the nurse regarding the use of different anti-diabetic agents. Demonstrate and explain thoroughly the procedure for insulin self injection. किस तरह आपने जो है self injection जो है उसको आपने administer करना है. Help patient to master the technique by taking a step by step approach, and it is also very important. So these are actually the teaching technique about the insulin. All patient time to handle insulin and syringe to become familiar with the equipments. Teach self-injection first to alleviate fear of the pain from injections. It means that you must will have to satisfy the patients psychologically. If psychologically the patient is satisfied, so mentally he or she will be satisfied. Instruct the patient in filling the syringe when he or she expresses confidence in self-injection procedure. Review dosing and time of injection in relation to meals, activity, and bedtime based on patient individualization. Insulin regime. Prevent the injury secondary to hypoglycemia. Closely monitor the blood glucose level to detect the hypoglycemic conditions. Instruct the patient and the importance of accuracy and insulin preparation in meal timing to avoid hypoglycemia. Inshallah, in my next lecture, I will tell you about the how to administer the insulin and what are the different doses which are available. In category number C, we will study about how to assess the patient for the sign and symptom of hypoglycemia. So in adrenergic early symptoms, there may be chances of sweatings, tremor, pallor, tachycardia, palpitation, nervousness from the release of adrenalines when blood glucose falls rapidly. So you will have to assess the patient the basic sign and symptom of the hypoglycemia. Let's suppose if the patient who is suffering from hypoglycemia, it means that hypoglycemic shock. So for example, if a patient who is hypoglycemia, so these are the earlier symptoms, so you must will have to check it. There may be sweating, tremor, pallor, tachycardia, decrease in heart rate, palpitation, nervousness from the release of adrenaline when the blood glucose falls rapidly. The second one is neurologic. These are the later symptoms after this. So light headaches, headaches, confusion, irritability, slurred speech, lack of coordination, staggering guide from the depression of central nervous system, and as glucose level progressively fall. So this is actually this lecture is about the fundamental nursing care regarding diabetes mellitus. That let's suppose if the patient who has a diabetes mellitus, so what are your basic responsibility, how you can handle the patient, and what are the basic this is simple word you can say the education regarding health. So what are the basic steps which are required for the nurse, and as well as to aware the patient about the use of different anti-diabetic agents. Thank you so much for watching my lecture. Inshallah, in my next lectures I will discuss about the use of insulin. So my next lecture will be on the insulin. Thank you.